At its most fundamental level, it's a malignant tumor, a cancer, that begins in the cells of the thyroid gland.
Right.
And these cancer cells can originate from either the follicular cells, those are the main ones, or the parafollicular C cells,
Uh,
and which cell it starts in. Turns out to be incredibly important for, well, pretty much everything that follows: prognosis, treatment, everything.
and who tends to get this? The notes had some interesting numbers on epidemiology.
They did. One kind of surprising finding is just how much the incidence is increasing globally.
Really? Why is that?
Well, a big reason seems to be better detection. Things like ultrasound-guided biopsies are finding smaller tumors we might have missed before.
Ah, okay. Makes sense. Better tools, more diagnoses.
Exactly. There's also a really significant gender disparity. It's about 3 times more common in females.
3 times.
Yeah.
Wow, that's a substantial difference. Why
Yeah.
females?
Well, the notes touch on a possible role for female sex hormones, but it's complex. And age plays a big role too, but it varies quite a bit depending on the specific type of thyroid cancer.
How so?
So papillary, the most common type, usually shows up between 20 and 50. Follicular tends to be a bit later, say 40 to 60.
Okay.
Medullary can be sporadic in adults, but there are also familial forms that can appear in younger patients. And then you have anaplastic, which we typically see in people over 60.
So even the who changes depending on the type.